thanks to our friends over at Guam Regional Medical City, we're going to hear a little bit more about that. Dr. Scott Shea joins us here on the program. Good afternoon, Dr. Shea.
Good afternoon, sir.
Hey, thanks so much. I understand that you are the interventional radiologist that has been commenting on this and made the statement about him being out of the coma and able to speak and even walk. What happened to this guy?
Well, on the 18th of July, in the late evening time frame, he developed a thunderclap headache, and then he had neurologic deterioration, inability to speak, move part of his body, and then he kind of became unresponsive. Their family called 911. They picked him up, and they were trying to drive him to actually GMH, but because of neurologic deterioration, they detoured to the nearest medical facility, which was the Naval Hospital.
Okay.
And he was over there for 11 days. He didn't get transferred to our facility until the early morning hours of the 29th of July, in part because he was unstable. He was on a breathing machine. He developed aspiration pneumonia, so he was a pretty sick guy. He had a hemorrhagic stroke, which they quickly diagnosed with a CAT scan of the brain.
Okay.
But they were unable to treat it. They were just trying to temporize the medical situation. On the 29th, he was transferred to our facility, and I performed a minimally invasive surgical procedure where I fixed the culprit in the brain, and he was in the ICU for 1 day and then was transferred to the floor. And as of this morning, he's walking, talking, neurologically intact. I suspect he'll be going home in a few days after more physical therapy, neurologically intact.
That is great news. Could you tell me a little bit more about what in the world coil embolization means? I haven't run across that yet today.
There's different types of strokes. His stroke was a hemorrhagic stroke. We treat all types of strokes at GRMC. We're the only stroke center on the island.
Okay.
In this case, the stroke was because of a aneurysm that had ruptured or busted. An aneurysm in the brain is like they call them berry aneurysms because they look like little berries, just a little bubble or blister originating off of a brain artery. And so it had ruptured. There's two ways to treat it. The conventional way is to crack the coconut or the skull and have a conventional neurosurgeon put a little clip at the base of the aneurysm to pinch off the base of the aneurysm so no more blood can flow into it so it can't bleed or rebleed or continue to bleed.
Yeah, I haven't seen a lot of procedures, but cracking the head.
And so in my case, I just crawled up from the top of the leg artery, through the belly, chest artery, up into the neck artery, and actually micro-catheterized, put a little catheter or a long hollow straw into the aneurysm. It was a little under 3 millimeters in size.
Okay.
And I deposited multiple platinum coils to fill up the aneurysm cavity or sac, preventing blood from flowing preventing into the aneurysm, and thereby preventing rebleeding of the aneurysm.
Oh my gosh! So rather than go in through this man's head, you took essentially a really specially purposed straw through his thigh,
through his thigh artery, up through the belly, neck, chest artery, into the neck artery, and then ultimately up into the brain artery, and actually place the straw, if you will, into the small 3 millimeter aneurysm.
Oh my gosh, that is amazing. I had no idea this kind of thing was happening all the time, and certainly not that it could be done here on Guam. That I really appreciate you taking the time to share that with us. We hear a lot about strokes and have heard that people on Guam seem to be particularly susceptible to strokes. What should we, given your special capabilities for people that have had strokes, I'm thinking if I have one, that's where I want to go. I'd rather not have one. What should we know basically about strokes?
Well, the stroke risk here on Guam, good question, is higher than the U.S. national average, in part because there's a higher incidence of diabetes and hypertension, oftentimes poorly controlled here.
Oh, boy.
My recommendation is if a patient's having any type of neurologic changes, particularly that occur suddenly, weakness in an arm, vision changes, speech changes, weakness or numbness in a leg or arm, they should seek immediate medical attention. Oftentimes we have what's called a TIA. It's a warning sign for a stroke. In this particular case, he had a spontaneous rupture of an aneurysm, and the only thing that you can do in this case is just screen first-degree family relatives. So I've advised that his siblings and his children be screened. There was no risk factors for this. This is just a spontaneous aneurysm, and so his hypertension and diabetes, none of that was really causative.
Oh, okay. So he didn't have one of those, but it is prevalent here on Guam, and since you've got a stroke center, that should be the place that they'd want to go. Now,
right, we're actually a bona fide neuroscience center. We have a board-certified neurologist and neurosurgeon as well, so we can provide the full gamut of neurologic care for these type of patients.
Well, that is good to hear. Thank you very much for making the time to join us, Dr. Shea, on this situation. So you're saying that this person's going to need some physical therapy, but the fact that you didn't have to go into his brain, it seems to me his recovery time is going to be a lot faster.
Oh, absolutely. It's actually a Band-Aid procedure. The incision at the top of the leg was so small I didn't even use a suture to approximate the incision edges. Just threw a little Band-Aid on there at the end of the procedure. We did use general anesthesia, of course, because we have to have a stature. He can't move. Otherwise, we can, rupture the aneurysm trying to coil it. But he woke up fine, and like I said, he was out of the ICU in 24 hours.
Well, that is good news. Thank you very much. Dr. Scott Shea with us here on the program talking about a comatose stroke victim that had a procedure at GRMC's Cath lab, and it sounds like he's doing a lot better than he would have had. He would have had some pretty invasive surgery in another circumstance. Thank you very much for your time, sir. And anytime something like this comes up, please let us know. We would love to know. And maybe the more people hear it, the more lives will be saved here on the island of Guam.
Yes, sir. Well, thank you for allowing me to speak on your show, and we'll keep you informed on future developments in our hospital.
Thank you very much. Appreciate it. GRMC, I gotta say, glad to have him here. Hey, I'm not planning to have a stroke, but anybody in the audience, you heard that? Stroke me, GRMC. Okay? I know. I mean, the kind of stroke that I was thinking about was, didn't Billy Squier do a stroke song? But we'll find that before the show is done.